As we continue commemorating Mandela Day, the Gauteng Health Department is embarking on what they call a massive surgical marathon. The department says this is to address the current surgery backlog. To date, the province has a backlog of over 18,000 patients awaiting surgical procedures. Let's get you a sense of how this is likely to unfold with the Gauteng Health MEC, Nomantu, Ralehoko, who joins us now via our video link. MEC, it's lovely to have you on the program, and happy Mandela Day, I suppose. Thanks very much indeed for your time. I mean, help us understand how you're going to be embarking on this massive surgical marathon. Where is this capacity coming from?
We have the capacity because you remember we have about 37 hospitals, but now we're going to utilize 32, and the small ones we're leaving them out of that 37. So we're taking 32, which is the academic hospitals, tertiary and regional and district hospitals. So we've started this at the beginning of this year when we discovered that we have a surgical backlog in the province, because we're sitting at 32,000. Then now we move up to 18,000 patients that are waiting for surgical procedures. So at least we're happy that there's that reduction that we're doing, but it's not enough. Yeah. So we just came up with a plan then that says let's go for Mandela Day so that we can start introducing this now after this. As much as we've been doing, it was not aggressively enough. Today, we believe that we will make a huge difference because we are working with private doctors and some public doctors that are in our institutions. Right. But each and every institution will have already started at 6 o'clock, by the way, because they start early doing these procedures. So they've already started with the procedures, those that are going to assist us in our own hospitals here. Of performing this. In fact, we said to them at least we're targeting about 700 elective surgeries on patients from the that are on the waiting list.
If the capacity, if I can come in there. Yeah, apologies for interrupting you there. If the capacity was always there, how did the backlog build up to begin with?
Let me clarify you. It was there, but unfortunately, some of the hospitals, like your regional hospitals, have not been doing some of these procedures. You remember I announced about the case in Mpumalanga that we have just done, and we're all excited about it because those big cases, we take them to the academic hospitals. So that was the problem that we've been having. But now we've built up the capacity in the district and regional hospitals. Because for me, you can't have theaters that are not being utilized. And you have surgeons that are employed, but those surgeons are not performing that work in those hospitals. Hence, Pethatua is one of those. Mpumalanga has been having some success stories now. Gauteng has been having some success stories. Patients from Gauteng, we used to take them to Baragwanath Hospital. So you can see at some stage how we've been managing the process. It was not correct, but I think it's because we didn't have so much backlog. The backlog comes from COVID-19, which is 2020, 21, and 22 financial years, where we were unable to perform any surgery. Hence, you find us at where we are now.
Yeah. Look, this is not to downplay any good work being done, especially in Madiba's name. But I suppose for many people, questions are going to be asked about why we had to, in some ways, wait for the 18th of July before ramping up these backlogs in a context where, let's face it, issues around there being a delay over surgeries, elective surgeries that have actually predated COVID-19 and the pandemic.
We didn't wait for Mandela Day. It has been subsequent. It's a culmination of the work that we've been doing. Since we picked it up, that now we have opened, we can do procedures, then that's when we had to start doing the work.
Yeah, but you spoke about ramping up those operations today.
It would be disingenuous of that person to say we've only done that work now. I'm saying to you, we've been doing that work since we've discovered that now we have a backlog. We've picked up that we have a backlog after we've done our assessment that we've closed everything down. COVID-19 didn't allow us to do any procedure. Now we need to reduce those. Part of this day is to ensure that it's not about just Mandela's name, but it's about making sure that on this day, this is when we started surgical marathon, officially so. And we will continuously be doing that. All these hospitals have been doing this work. That's why I'm saying some of them have never performed these procedures, but we had surgeries. But now we are improving at that level and make sure that even if you're a regional or a district hospital, when you have a surgeon that can perform a specific discipline, they must do that work. Yes. So that's what we're doing. So that's why I will not listen to a person that says we're waiting for Mandela Day. It's not about Mandela Day, but it's about now raising the flag on this day and bringing private sector on board to start working with us And we have doctors in private sector now that they are going to work with us today in ensuring that we finalize these processes, we do these procedures, because everybody do care. And I think it fitted so well to us when we use Mandela Day as a day that we are starting bringing everybody on board.
Yes, MEC, whatever you're doing differently today, questions are going to be asked about why it couldn't have been done much earlier. Let's respond to that.
We've been doing it much earlier, Sani. I'm telling you that.
Whatever improvement you're doing, the ramping up of these operations, I mean, I'm sure we agree that there is something differently that you're doing today, right?
Yes.
Exactly. And what I'm asking is, what is it that has allowed you to wait until the 18th of July when we know how urgent this actually was?
I'm trying to scrap the word wait. We didn't wait. We have been doing this. Leratong and other hospitals have been performing these surgeries during the week and even in the weekends, and we have been bringing in other people. The difference now is that we are bringing public sector, public doctors that are working in public and private. Now we're bringing them together to do these surgeries. That's the difference that people must appreciate and must be good, happy about it, that finally we work together with some of the doctors that are not employed in our public hospitals.
That partnership happens to fall on the 18th of July.
Absolutely, because we wanted to make a mark on this day that it's starting now and it's going to continue. Besides that, there were minor partnerships that we've been doing, like in Leratong. You'll find a private doctor coming in there assisting us. But now we are making it an aggressive approach of something that is in our books that we'll be doing it on quarterly basis. That's the clarity that I want us to tell the citizens, that it's something new that we have not done, indeed, of working together in one room in a public hospital with a private doctor that has never worked there to assist us on this day.
All right.
They're donating his time because we're not going to pay them. They're donating their time on the day of Nelson Mandela. We're not employing them. It's their contribution that they must do, that we want them to do as doctors of this country. And by the way, the doctors are themselves that said they want to be part of this initiative. And I think it's something that we must clarify, citizens. It's not only us, even themselves. They want this, they are happy about it, and they're excited about the initiative.
MEC Nkomo Ralehoko, thanks very much indeed for speaking to us. Really do appreciate your time. The MEC of Health in Gauteng is Nomantu Ralehoko. Once again, thanks very much indeed.